Our first guest today is Shelbourn Stevens, the president of New Hanover Regional Medical Center and Novant Health Coastal Market. Thanks for getting back to us. I've been missing you so bad.
It's good to be back down here.
We
Jen.
needed to get you back here. We all have been just wondering how you're doing.
I'm doing very well.
Good. Well, let's start with COVID-19, the big elephant in the room. So, our hospital has been just inundated with COVID and with just patients in general. How about New Hanover?
It's the same. We have been full. We've been holding next to 100 patients a day in our ED waiting for a bed, and then being the regional transfer center, we have patients out in the region, but just seeing extremely high volumes. Not quite as high as we saw last fall.
Yeah.
Thank goodness. That was a bigger surge, but we are seeing a lot of folks this time around.
Yeah. It's been crazy here, but our team has really stepped up, as yours has, and
they have been amazing. They have stayed focused on their patients and the families, and taking care of them, and while also trying to protect themselves and not catching themselves. That's been a big risk this time around.
And I know that Novant Health helped out here locally at Brunswick. How about at New Hanover with supplies and equipment?
Absolutely. Last fall, both hospitals were getting very close to needing more ventilators. And fortunately, with the logistics center in Kannapolis, we're able to bring some ventilators down here to help support both facilities so that we had enough to meet the demand.
Yeah, the morning calls are interesting when everybody tells us what they need. They need this, they need medication, they need beds, stretchers. So it's pretty interesting in the morning.
Yes.
So. Let's talk about vaccines. How's that going?
Vaccines has gone very well. Together with New Hanover and Brunswick for the region, we've been able to vaccinate over 116,000 people.
When I saw that number, I couldn't believe it.
It's huge, and a lot of people now are getting their boosters, which is good with this new variant being so contagious. So we're still working with local health departments to get as many vaccines out there as we can.
How about equitable access? What do you think? Are we getting the vaccines to the people who really need it? Are we?
Absolutely. We've been working with several of the marginalized communities about having events in their areas. We've turned a lot of that over to the health departments now.
Right.
But prior to that, we were working with churches and other civic groups to really go meet the patients in their community so that they don't have to travel for a vaccine.
Yeah. I'm hoping we don't end up in the parking lot again. I'm hoping we... do you remember those days?
There were some good days when it was warm, but there were some rough days when it was cold and rainy.
Really bad days. When you showed up, it always rained.
It did always rain. I had a black cloud, so to speak, over me.
So to speak,
But we made the best of it.
We did. We had fun, and we did a good job.
We did.
Yeah. The next thing I want to talk about is sharing some experiences. For many years, you were the president here at Brunswick Medical Center, and then you got even more responsibility when you became the president at New Hanover Regional Medical Center. And that's a pretty big team. That's a lot of people. I couldn't believe that number either when I saw it. 8,400 team members?
Yes, in the coastal region now we have a little over 8,400 team members. It's actually been a pretty easy transition. The team there has been very welcoming to me. Really? I've enjoyed getting to know the team members and the providers and what their needs are. And really it was seamless because our atmosphere and environment was so similar. We're all focused on improving the health of our communities one person at a time. So it was an easy transition to make up there, and then working together as a region to take care of our communities. It's been really easy.
Yeah. Both organizations were so well respected, and that made it easy, I think, for the community. I still think we have some opportunity out there to help people understand that we are one and the same now.
Absolutely. And that's where we're working with bringing more specialists down here to Brunswick where we can, and been keeping patients here local for their health care. And we've still got a lot of work to do. It's still only been coming up on the first year, but we've gotten a lot of work done.
And I think I read in the paper where you all built a habitat house. Habitat for Humanity house?
We did. New Hanover has, for years, done a Habitat
Yeah.
for Humanity house that they do for one of their own team members. And
That's
so
what's
this
so-
year we were able to let the Brunswick team come and enjoy building the house as well, and got to meet the team member on her house. So it was really awesome.
That's really special when you could do it for a team member.
Absolutely.
I would love to see that happen here in the Shallotte or Supply area. Well, it's the end of year one. We've had our first year, and it's gone really well and pretty smoothly, I think. I'm excited about what's coming up, but let's talk about some of the highlights of year one.
So there's been a lot. I mean,
I know,
who integrates
I
a
know. Do we have
healthcare?
enough time for this?
I know. Who integrates a healthcare system during a pandemic?
I don't know.
So you double whammy there. But there's been a lot. I mean, immediately we were able to implement the healthy living wage, which impacted a little over 1,100 team members.
That
For
was
New
amazing.
Hanover to $15 an hour.
Right.
We were able to adopt our charity care policy. New Hanover's was 200% of the federal poverty
Right.
level. Novant Health is 300%. So that was implemented on February 1st, which really means if you have a household of 4 with an income below $78,600 and no insurance, no access to insurance, you don't receive a bill from us.
To me, that is truly amazing. I think that's one of the best things Novant Health ever did.
Yeah.
How about the Leapfrog Study?
So that's probably the biggest thing that we've done is Leapfrog is a national score for all hospitals in the U.S. that grades you on your quality and safety programs and meeting certain metrics. And both New Hanover and Brunswick Medical Center were A's this past fall, so we're very proud about that. As a matter of fact, all of our Novant Health hospitals were A's for the first time.
Yeah, I've seen billboards to that effect, and we're so proud because quality is a huge focus area for us. We've always been all about the quality, so to be recognized by Leapfrog is pretty amazing.
It is.
Tell me about physician recruitment.
So we've had a lot of activity around there. There were some commitments in the asset purchase agreement to meet some of the needs, and we're well on our way to hit that commitment in year 2. We've had around 25 or so that have actively been recruited and started, and another 30 or so that are coming in the next few months.
Yeah, there just are too few physicians, and it was hard to believe we got along with so few for
Yes.
so long.
Absolutely.
So that's a really huge, a huge thing for us. Tell me about your stroke program.
So we've had a strong stroke program at both facilities, and Brunswick has been stroke ready. New Hanover has been the regional referral center there. So that continues to grow, but we were able to add artificial intelligence with the merger, Viz AI, to the CT machines. We've had it at Brunswick now for a couple of years, which means if you come in with symptoms of a stroke, we
Right.
scan you. The device on there automatically senses the bleed and sends a text message to the team, including the provider, and we're able to start treatments immediately.
So that means the provider knows immediately he's still not here. Maybe he's
Yeah, he could be off-site, he could be in
Right.
his office, he could be in the ED someplace else, and he gets a text with a picture of the image with
you're
all of your
kidding.
information. Yes,
and so we have that at both facilities.
we do.
That is really amazing. But when I read that Viz.ai, I wasn't sure what that was.
Artificial intelligence.
Artificial intelligence. Well, that's excellent, and it's impressive to hear those kinds of advancements are happening. And let's talk about access to care. I know that we've been trying to meet the people where they are. We're trying to open up more clinics. Talk to me about that.
Yeah, so one of the big steps with that is from the Michael Jordan Foundation. He grew up in Wilmington. His foundation made a $10 million contribution, and we'll have 2 Michael Jordan clinics opening in roughly around 2023, 2024 in the Wilmington area. And we're beginning to assess where there might be other clinics in the future. But those are in neighborhoods where there is no access to health care. And we can bring that locally to those communities. And then in addition, we're always looking at where we have our primary cares and where there's gaps
Right.
and how we recruit more to there.
The Michael Jordan clinics, are they at opposite ends? Where are they located? At what areas?
They're in different areas of Wilmington at different addresses, kind of more in the central area, but
Okay.
it's underserved populations.
Well, that's great. Do we have something coming up in 23 or 24 about with new clinics? And
We have lots of different clinics that will be coming up for sure. Michael Jordan will hopefully open in those 2 years there. In the meantime, we're looking at a mobile clinic that could go on site and then eventually travel throughout the region as well.
wow, lots of things going on, huh? Talk to me about the partnership with UNC.
So that's going well. It's two pieces to that. There's one that's around the residency program
Yeah.
that was already at New Hanover, but we've committed, along with UNC, to expand that program to bring more residents to the region, and hopefully they would love the Wilmington area and want to stay here and practice. And then the other side of that is around pediatric services, along with our medical group and bringing pediatric specialists to the region to help meet the needs of the pediatric population.
Yeah, that's a big thing. I'm real excited about that. I was talking with someone the other day, and it's so nice they don't have to travel
Exactly.
to anywhere else, because we're going to have that caliber of physician right here locally, and
Absolutely.
so that's going to really help augment the pediatric practices and stuff
Agreed.
around the area. Let's talk about what's on the horizon. A lot, I know, and we've got another hospital coming up. So tell me about the growth and the facilities.
Yeah, so COVID has just expedited the population growth here. Everyone's moving out of the Northeast, and
They're coming
so,
here?
Yeah, they're everywhere. So we did get a certificate of need approval for the Scotts Hill Community Hospital, which is in the north end of Wilmington.
Right.
We'll be breaking ground on that soon, and hopefully open that up by the end of 2024. Along with that, will be a medical office building on campus there. That's also located where our freestanding ED is, so the hospital
Yeah,
will
I
be
know where
built
that is.
around that. And then here in Brunswick County, we're going to be breaking ground to build a new medical office building here at the hospital campus to help us expand some of those specialty clinics and access to care here for the Brunswick community as well. Novant Health is committed over the next 10 years, a lot of money, several hundreds of millions of dollars in capital investments to help grow the healthcare services. So we're committed to doing that over the next several years.
Yeah, Laurie's going to be with us later today, and she's going to talk to us about that North Tower, or about the neurosciences patient
Yes.
tower. So that's really exciting.
It is very exciting.
Yeah, and I was, when I came to work the other day and I saw all the, there's paint on the roads and all those flags and out in the yard and stuff where they're marking off, and that's really exciting, because next thing I know, there'll be dirt there.
That's exactly
They're
right.
going to turn dirt, so I'm really excited about that. We'll have to plan something special when that happens.
Yeah.
So. It looks like Novant Health has committed a lot of money, and they're following through with that, and that's really important. And I think the folks in the community will see for themselves what this merger has done for them and our patients in this area. But before we close, is there anything else you'd like to highlight?
Really, we're just excited about being able to expand access to health care for the entire region. We've pulled out Legacy New Hanover and Legacy Brunswick Medical Center master facility plans, and we're looking at those as a region now of where there's gaps in services and where there's opportunities to add. And again, how can we bring more specialists down here to Brunswick County and other areas that we serve around here? So it's very exciting. We got a lot of work to do and a lot more integration to happen, but a lot of great things have happened in this first year.
Well, I thank you so much for coming today, and I hope you'll come back very soon. There's so many things to talk about, and we always enjoyed having you on the show. And we didn't crack up yet, or we didn't have to stop and start. We did all sometimes.
It's all those years of practice with you,
All
Julie.
those years of practice. That's what I said in my opening. We're going to have two guests today that you're familiar with, one more than the other. And so I know that our viewers are going to enjoy having you back today, too.
It's always good to be here with you.
Take care.
Thanks.